Hey everybody, good Monday to you. My name is Lisa Dewey and I'm here with Cory Gerwe. I think I said that right, Cory.
Yeah.
I am from Clinician Connection, and we're doing a series where we're talking to all of the speakers about the conference and just kind of a get to know you series. And so welcome, Cory. Nice to see you on Monday.
Hey, happy to be here. Thanks for having
Yeah.
me.
Yeah, it's been busy. We were just talking before that it's just been a Monday. Monday's been Mondaying, but I don't know. Let's just get right into it. Where are you? Where you do a lot of things. You do a lot of different things.
Yeah.
Give me the lowdown on what you do.
So right now I'm at EVMS, Eastern Virginia Medical School. So I'm assistant professor in psychiatry there. I'm fortunate to be the director of well-being, coaching, and leadership in the graduate medical education program, which is really cool. Basically, I get to work with the residents, help them be well, help them with their communication skills, essentially help them with those things that they may not learn in med school, or they won't necessarily learn as part of being a physician, but are absolutely necessary, like helping them to learn how to break bad news to patients. Uh,
Yeah.
so my gig here is pretty cool. Oh, I also get to do LGBTQ plus trainings here. I get to do them for all the different programs, which is really awesome that they let me do that. Actually, last week I did one for ophthalmology,
Oh wow.
which
Okay.
yeah, it's very relevant for ophthalmology. I got to introduce a bunch of research and have really great conversations about being LGBT affirming, which is cool. Uh,
Yeah.
so on top of that, I am an adjunct professor at ODU. So I'm adjunct professor in their counselor education program, which is really great. Right now, I'm actually teaching group counseling there. Next semester, I'll be doing theories. I'll be teaching theories, which is great. I really enjoy that. I also sort of my side gig, I guess. I do some contract supervision with the LGBT Life Center,
Okay.
which in the past I actually was the director of mental health for the LGBT Life Center here in Norfolk, Virginia, which is just a great place that is very supportive of the community, and they really provide a lot of great resources.
They do. They do. We're super familiar with them. They Evelyn was over a few weeks ago. Yeah.
Yeah, she's great.
Yeah. Yeah, she is. You sound like you got a lot of irons in the fire, but it sounds like it all meshes super well.
Yeah, it really does. I think the things I do all tend to complement one another and
Yeah.
kind of
Yeah.
stick together and blur
Uh,
together too. But
Yeah, and I love what you said about like just the thing that you are doing at EVMS where you're talking with doctors about certain things that are just difficult.
yeah,
Some of the things that they don't learn in school. I think we try to do that with clinicians too. Probably different things, but still same kind of spirit of just stuff that you can never be prepared for. But hey, let me just let you in on a little secret here. This is happening.
right.
Yeah. So you're presenting on trauma informed care for LGBTQ plus.
Yeah,
So tell me a little bit about that passion for the topic, um, and what people can expect from the presentation.
sure. So my passion for the topic is really twofold. I would say professionally, as I mentioned, I spent over 5 years at the LGBT Life Center, and I worked with a lot of LGBTQ plus folks, and I was finding that a lot of them experience some form of trauma. And it really would it behooved me to be able to focus on that, to be able to help them work through that in an affirming manner. Um, and that's why I think the intersection of these two topics is so important. Because when we talk about being LGBT affirming, what are we talking about? We're talking about relationships, understanding people's identity and how that impacts them and building that relationship. And then when you talk about trauma informed care, that's really a very interpersonal experience that takes a lot of trust and safety for people to be able to explore that. So I really think these two topics are perfect bedfellows.
Yeah.
So I mentioned the professional part. The other reason I'm so passionate about it is because I'm part of the community, with my own identity, and my own experience with trauma. So I know how important it is to address both of these aspects of a person. And if you're leaving out one's identity, or if you're leaving out trauma, you're not really treating the whole person. You're
Right.
probably going to be missing something, in my opinion.
Yeah.
So that's why I'm so passionate about this, because I think it's really it's needed, and with regard to being effective, I would say, in therapy. I think it's certainly needed to really engage a person holistically.
Yeah. And I think, it's just the thing about not knowing, no, we don't know what we don't know. And just the
Yeah,
approach of the trauma informed, that's what really, I'm really ready to hear that, because we don't know what we don't know. And I think we try, and sometimes we don't get it right.
yeah, I
Yeah.
what you're saying, and it kind of reminds me, to no fault of the institution in which I'm articulated through, but I don't recall getting training specifically on trauma, at least not as in depth as I did later on in my
Right.
career. um, which, getting that training and having a further understanding of how trauma impacts a person, especially somatically, and it impacts the entire body, was just so helpful for me, and understanding the science behind trauma as well. Um, I think there were some things I probably would do a little bit differently with some of my clients in retrospect. Um,
Yeah. I can
knowing
say that too.
yeah,
Yeah. Yeah.
yeah,
I could say the exact same. We didn't get trained in it, and there was definitely things I would do differently.
yeah.
But now we know.
Now we know, yeah,
Now we know.
it's part
All
of the
right.
process, I suppose, right?
Yeah. So
Yeah.
what excites you about speaking at Clinician Connection, our first big event in Virginia Beach in April of next year?
Sure. Well, I would say what excites me the most, um, is the opportunity to come together with other clinicians, to
Hmm.
come together specifically with clinicians who are in different categories. So who are not just counselors, but social workers, as you mentioned before, nurse practitioners,
Hmm.
psychologists, just to see the mental health community come together in this way. That excites me the most. And then the opportunity to talk about trauma informed care, to talk about being LGBTQ affirming.
Yeah.
It's truly a passion of mine, and I'm excited every chance I get to share knowledge on it.
I think this conference is shaping up to be it's enough good topics where it's for licensed clinicians, pre-licensed clinicians, people that are just going to school, people that not just going to school, but going to school, just kind of that whole gamut. So we're excited. We were kind of talking about that, like, yeah, anybody can come. Um,
Yeah,
all right, so the fun questions, you ready?
yeah.
Ready for the fun ones? All right. If you were not in the mental health field, what would you be doing?
Good question. I thought for a little bit maybe mechanic.
Okay.
But there's one problem with that. I think I get too frustrated with machines.
If you they don't go right, they don't go right.
Yeah, and I have a certain patience, and I guess I don't know if tolerance is the right word, but just I guess compassion for people that does not translate to vehicles. Um,
Oh,
and
yeah,
I can work on cars of a certain age. uh,
yeah,
but to be honest with you, the more they advance, the less I know, the more electronic they get. I'm like, oh, I don't know
yeah.
if
They
I'm
got
there.
computers in them now.
So yeah, so I don't know if that would be it. I probably would still want to help people. So maybe in public health or in healthcare, which is kind of
Good.
adjacent to what I do. Uh,
Yeah,
maybe I think it would be cool to be like a traveling nurse. That might be cool.
yeah. That would be cool.
Get to travel a little bit, still get to be a nurse, and Get to,
Yeah, that would be good. That's all good choices. Yeah,
yeah,
mechanic. I
yeah.
would get too frustrated.
I think I would too, even though I'm okay at fixing cars, but like I think, yeah,
Yeah, I did.
will.
Yeah, there's some sophistication now. All right, so last TV show, podcast that you binged, or kind of a maybe a go-to movie or music that you can kind of do on repeat, whatever that, or
Sure.
all of it.
So, me and my partner, we seem to find ourselves watching Law and Order SVU. Uh,
Yeah,
so that's always
so
good.
good.
And then RuPaul seems to be our thing.
Yeah,
We love RuPaul. And then when RuPaul comes out, it's great because usually we can, go out in the community and watch it with other people, either like at a
mhm,
friend's house or um, they play it at the Wave as well. So there's a few different options to, not just watch it at home, to actually have like some
yeah,
connection and conversations about the
yeah,
drag shows, which I think is really cool.
yeah. I do too. I like that show, and I'm a big SVU fan.
Yeah,
SVU. So
yeah,
many different types of that show. Was it 20 years it's been on? How many years? Something
yeah,
like that.
yeah.
Yeah.
It's wild to
Crazy.
watch it like when it was like in the 90s.
Yeah.
Oh, it's
Look at the fashion.
yeah.
That's where my
Um,
head goes right away. Like, oh wow.
they did that. That's
Yeah. Like they said that. And or you remember one of the cases that they're talking about and it happened in real life. And you're like, oh, I forgot about that one.
yeah, isn't that
Yeah,
wild? Because a lot like they tend to grab from the headlines.
they do. They do.
Yeah,
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 they do. They
interesting.
do. Is there anything else that you want us to know about you or anything to share and about it? I don't know. Anything exciting or
Uh,
not?
I don't know if there's anything exciting. I'll just say, I'm very excited about doing this type of training. I've done it. I've done this specific one in a few different locations. I've provided it to a few different community services board
Mhm.
divisions. I've also done LGBT training really all over Hampton Roads. I provided to addictions facilities. I provided to military installations. I did a whole bunch of military ones. They
Yeah,
tend
that's
to
great to hear.
they like to check that box and jam.
Yeah,
Um, but so I've really done this all over, and I'll tell you, it never gets old.
yeah,
I just enjoy talking about it so much and helping people understand why it's important. And it also never gets old because the research is not old, so it's always
yeah,
updating. It's not it's not the same or anything like the training I did 7-8 years ago, because the research keeps advancing. Um,
yeah.
so I'm really excited to be able to provide this training.
Yeah, I'm really excited to hear about it through the trauma informed lens. I
Uh,
haven't heard about it through that. I mean, I know the two. I'd love to. I can't wait to hear them together. And yeah, I can't wait to hear you speak. Yeah,
yeah,
I'm excited.
me too.
Yeah, yeah. Well, guys, thank you. Thank you for stopping by and coming to see me or virtually. And I appreciate your time. And we will see you in April, if not before.